pharmacist at Thika Level 5, where he has worked since the 1st of August 2024 with no salary in those 4 months. Earlier in September, we sadly lost Dr. Desire Mora under similar circumstances. This now brings a total number of 2 interns who we've lost in 2 months under the same similar circumstances. I'm also aware of 5 other interns who have attempted suicide. Unfortunately, who were rescued and hospitalized. The only crime of these interns, those who have passed on and those who have attempted to take their lives, is only choosing medical career. On the 8th of May 2024, we called off our 56 days strike after the government promised to resolve the impasse within 60 days. 7 months down the line, we are still waiting. 7 months down the line, we are still negotiating. 7 months down the line, the courts have still directed us to go and talk with the government. We have seen, and we are asking, that how many more doctor interns must die for this government to keep its promises? How many more doctors must we lose for the government to stop the culture of lies and to commit to agreements that have been signed? As a union, we find these inhumane acts by governments that does not care about the health of its workers. This is unacceptable behavior. And therefore, we demand that these intern doctors that are currently working, that have labored for the last 4 months, be paid their salaries immediately, as per the CBA agreement that we signed 7 years ago. We don't yet know what is new with this government, that they have decided to reinvent the wheel, that the payment that has been done seamlessly for 7 years is now causing death, mayhem, and suffering of doctors who are expected to offer services in the hospitals. We have had rhetorics and calls and talks about universal health care. But we want to ask, how is universal health care deliverable when the government is out to kill the same persons who ought to offer these services in the hospitals by ensuring that they're not paid, they're not supported, they're not motivated? It is not possible. This afternoon, after careful deliberation by the branch leaders and by the union in entirety, we are asking all the medical doctor interns across the country, in all the facilities, to stay at home immediately. That we will not afford to see any more deaths out of desperation, despair, and disillusionment that are caused by hardworking conditions. And you must go stay at home as we try to discuss these matters with the government. At the same time, we have our special delegate conference that is scheduled for 30th of November 2024, which will see all doctors across the country from both the public sector and private sector congregate at Safari Park Hotel with one sole agenda: to issue a national strike, to ask the government to honor its side of the bargain. And we know it will be a sad situation in that time, but government is entirely responsible because they're failing to honor agreements and they're failing to honor court orders. The government is solely to blame for the untimely demise of our 2 young colleagues because they are the ones that have decided to dishonor agreements and to frustrate them at their places of work. And the government will equally take blames for the innocent Kenyans that will lose their lives during our total shutdown that is coming in the month of December. We are saying this without any fear of contradiction, that when we call a strike, nobody should come to us and sell for us the aspect of goodwill or the aspect of negotiation, because 7 months is far too long for somebody to keep on saying promises. It will be time to implement the agreements that were signed and that have been adopted as court order. Thank you. So in summary, we are saddened by the 2 lives that we've lost. Because these are children of persons. These are human beings. These are persons that have gone to school and the persons that are dedicated to serve Kenyans. And because of undoing of the government, they have decided to erratically change what has existed for the last 7 years without any goodwill or good intention to solve it. As a union, we have tried to be patient and to negotiate with goodwill. But our patience has been mistaken for weakness. Because when we go on strike, it is different. It doesn't mean that the roads will delay. It doesn't mean if you go on strike that children will not go to school. When we go on strike, people lose their lives. It's a different case. And therefore, as a union, we try as much as possible not to proceed on strikes. But as we always say before, that we went on strike in the month of March because government had been on strike for 7 years. And I will say that we will go on strike in the month of December because the government does not care about the Kenyans. They are very much caring about deductions and about taxes, but not about the service delivery. That's why we will proceed. And at this time when we proceed, we'll be having a return to work formula that ought to be implemented, that the interns ought to be paid before we resume duties, that the doctors ought to be paid monies owed to them before we resume duty. We will not be going on strike and asking to sit down and negotiate. We will be going out and asking to have the outcome seen before we resume duties, because the government seems not trustworthy anymore.